Hi, welcome to Mondays with Melissa. It's that time of year again, October 15th through December 7th, open enrollment for Medicare. This is the time of year where you can sign up for your Medicare policy or you can make a change to your current policy and make sure that your Medicare Part D prescription drug plan is still working for you. One of the questions we get asked all the time is, what's the difference between Medicare and Medicaid? And my answer to that is typically Medicare is going to be more of a short-term payer. So Medicare, as many of you know, covers your doctors, hospital visits, and other specialists and things like that to a certain degree. Some people have Medicare Advantage plans that may cover more, and a lot of people have Medigap, which is supplemental coverage that picks up what Medicare doesn't. But Medicaid is the payer of last resort. So people who go into a nursing home or people who need care at home and they apply for Medicaid, they're still going to keep their Medicare. They don't need to get rid of it. They're not going to lose it because Medicare is going to be your first payer, your primary payer. And then you have your supplemental, or if you have a Medicare Advantage plan, it's kind of 2 in 1. And then Medicaid is going to pay after that. For example, if you go into a nursing home, Medicare is going to cover your first 20 days in full, and then days 21 to 100, there's a copay, which may or may not be covered by your supplemental insurance. Once those 100 days are up, Medicare is not going to pay for anything else, unless you go out to the hospital for some reason and come back, and there's been a time that has passed in between, then you may get another 100 days. Otherwise, room and board, the cost of the nursing home, which could be upwards of $15,000 or $16,000, that is not going to be covered by Medicare, and that is when you look to Medicaid. So Medicaid is going to be more of the long-term payer. Another thing for home care is people will say to me, well, my Medicare will cover that, my health insurance will cover that. If you're in the hospital and you go home from the hospital, sometimes Medicare and your supplemental insurance will give you a few hours of home care for a few weeks for you to get acclimated to being back in the home. But again, it's a short-term payer. It is not a long-term solution. So if you're going to need home care in the home going forward for a longer period of time or for the future indefinitely, you're going to want to look at the Medicaid home care program. This information is all available on our website, konaelderlaw.com, and you can always feel free to reach out if you want to talk more about the differences and what Medicare and Medicaid cover. But please put any questions into the comments. I'd be happy to answer them. Otherwise, I'll see you next week.